Hi everyone, welcome back to my YouTube channel, and today we are going to talk about salivary gland anatomy. So let's start our topic with introduction. Salivary glands are exocrine glands that secrete saliva into the oral cavity. Saliva is essential for lubrication, digestion, for taste, for speech, and for oral hygiene. There are three pairs of major salivary glands and numerous minor glands. The major salivary gland includes parotid gland, submandibular gland, and sublingual gland, and other are minor salivary glands that are scattered throughout the oral mucosa that may be in the lips, in the cheeks, in the palate, or in the tongue. Classification of salivary gland include major salivary gland that are large paired glands that produce more saliva volume. Then there are minor salivary glands that are numerous small glands that produce continuous secretion for oral moisture. Now let's talk about parotid gland, that is the first major salivary gland. It is the largest salivary gland and it is situated in the front of and above the ear and below the ear, and it is over the masseter muscle. Its shape is about pyramidal shape, and it is enclosed in a tough facial capsule that is derived from the investing layer of deep cervical fascia. Its duct is called a Stensen's duct that opens opposite to the upper second molar tooth into the vestibule of the mouth. Its secretion is serous secretion, that is watery and enzyme-rich secretion. Its relation include that it is contain important structure like facial nerve, that is the seventh cranial nerve, retromandibular vein, and external carotid artery. And these are the important relations of parotid gland. Nerve supply includes parotid gland includes parasympathetic nerve supply, sympathetic nerve supply, and parasympathetic nerve supply of the parotid gland is by glossopharyngeal nerve through the aortic ganglion, and sympathetic nerve supply of parotid gland is from the superior cervical ganglion. And the clinical notes of parotid gland may include parotitis, that is the mumps, or parotid tumor, and facial nerve injury during surgery of the any during any gland surgery. Next, a major salivary gland we have is submandibular gland, that is situated beneath the mandible in the submandibular triangle. It is walnut-sized gland, and its duct is called as Wharton ducts that open at the floor of mouth near the lingual frenulum. Its secretion is mixed, but has more serious secretion than the mucus secretion. Its important relation include lingual nerve lead loops are under the duct of the submandibular gland. Nerve supply of this gland include parasympathetic nerve supply and sympathetic nerve supply. Parasympathetic nerve supply is by the facial nerve, that is seventh cranial nerve, through the chora tympani and submandibular ganglion. And sympathetic nerve supply of submandibular gland is from the superior cervical ganglion. This gland is common site for the salivary calculi. Next, major salivary gland is sublingual gland. It is a smallest major salivary gland that is present beneath the mucosa of the floor of the mouth, and it is present anterior to the submandibular gland. It has multiple small ducts that are raminis duct, and they open along the sublingual fold. Its secretion is predominantly mucus secretion, and its nerve supply may include parasympathetic nerve supply and sympathetic nerve supply. Parasympathetic nerve supply of sublingual gland is from the facial nerve through the chora tympani and submandibular ganglion, and sympathetic nerve supply of sublingual gland is from superior cervical ganglion. There is ranula, that is the most common problem or most common clinical scenario that is related to sublingual gland. Now let's talk about minor salivary gland. Minor salivary glands are distributed throughout the oral mucosa. They may be in the lips, in the cheeks, in the tongue, and in the palate. Their function is continuous secretion to keep oral mucosa moist. Blood supply of salivary gland. They include blood supply of salivary gland include arterial supply and venous drainage. Arterial supply of the salivary gland is by the branches of external carotid artery that include facial artery, lingual artery, and maxillary artery. And venous drainage of the salivary gland is by the corresponding veins that drain into internal or external jugular vein. Talking about lymphatic drainage of salivary gland, parotid gland drain into the preauricular and parotid lymph nodes, submandibular gland drain into the submandibular lymph node, and sublingual gland drain into the submental and submandibular lymph nodes. Functions of salivary gland include: first is moistening and lubrication, as this gland secretion facilitates speech, swallowing, and mastication. Second function is digestion, as enzyme like amylase that is present in these gland secretion break down the starch. Third function is taste, as this secretion solubilize substances for taste perception. Fourth function of salivary gland is protection, as there are antibacterial action through lysozyme and immunoglobulin A that is present in the secretion of salivary gland. Fifth function is buffering function, as they maintain oral pH and prevent tooth decay. Talking about clinical significance of salivary gland, first is mumps, that is viral infection that cause painful parotid swelling. Second significance is halolithiasis, that is salivary gland stones that are common in submandibular gland. Third significance is silidinitis, that is bacterial infection due to duct obstruction. Fourth significance is tumor, that parotid tumor are the most common tumor, and careful surgery needed to protect facial nerve as it is present right along it. Fifth significance is dry mouth or xerostomia, as due to salivary gland dysfunction or radiation therapy, it can cause zero secretion or minimum secretion that cause dry mouth. Now let's talk about conclusion of this lecture video. Salivary glands are vital structure that maintain oral health and aid digestion. Their anatomical position, nerve supply, and ductal opening are crucial in clinical practice. A strong understanding of their structure is essential for diagnosing and treating oral and maxillofacial conditions. And this was all about salivary glands. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.